I work in a federally qualified health center. I'm a dental operations manager and a public health hygienist. And in June of 2020, and for most of us, that's when we were just getting back to providing dental care in office. We decided that we were going to use that time with no schedule, because when has that ever happened, ever, where we have zero schedule, to work on some integrations. So we did a behavioral health integration into our oral health program. We talk a lot about oral health integrated into our primary care department. This is kind of the opposite. This is kind of primary care, behavioral health integrating into the oral health side of the building. So I put this screen up because it kind of answers why would we do this. Helen told me, you can see it right on here, and here I am turning anyway. So I want you to see there, so for us, based on our 2019 UDS data, 66% of our patients were dental patients in our center. So for us, we're still working on dual patients with medical and dental. We're about 23%. So most of our dental patients are dental patients only, and we're able to provide a ton of services that our dental patients really never knew about. So we began in July is when we started our pilot program. We used one assistant and 2 hygienists. The reason we did that is because I needed to be able to evaluate workflow, and the dentist and the hygienist, we just have different workflows. So we chose an assistant and 2 hygienists, and I'm gonna tell you, and I love oral health. Anyone that knows me will tell you that. I did not think that this was gonna work at all. I thought dental patients are gonna be like, what are you asking me these questions for? I was very surprised by the outcome, and we'll get to that. So we were very lucky. We got a grant, and we were able to employ a patient navigator in dental. So our dental center has a social service worker dedicated strictly to our dental center and our dental patients. If you want to do a behavioral health integration and you are able to make that work, I would recommend it. So we called her oral health patient navigator, and we also had a behavioral health consultant. We have a licensed social worker in our facility. And then the training, we just did it at a monthly staff meeting. I usually separate staff meetings between the hygienists and assistants in front office, but we try to do some together ones too. So we did this at a together one, and you know, it was tough then. I think we all remember how tough it was to get started again. People were afraid. Everything was new for us. It took us forever to get ready. We weren't really sure how to get the dentist in, and you know, there was just a lot going on. So I was really concerned that the staff maybe wouldn't embrace us. So we did this training, and the content of the training was importance of the integration. So, and I apologize because when I first made this slide deck up, it was for dental professionals. So if you are not a dental professional, there are dental professionals at your table, and they can explain to you why and how behavioral health, depression, how that relates to oral health. One thing is medication. We all know that it causes dry mouth, but also all the other things, you know, lack of hygiene, and all of those things. So talk to your table. They can help you out with that. We talked about what their role in the program was going to be, because as we all know, we do a lot. And we're always concerned, how are we gonna add this and still do dental? Trauma and empathy training, and this was completely brand new for our entire dental staff, especially that ACE, so the behavioral health, it's adverse childhood experiences, and this was such a powerful piece to our training. And if anyone's interested in it, I'm happy to provide you with the entire training slide deck that we created, because that does have all of the ACE information on it. Scripting for specific scenarios, our team was concerned that they were that it was not going to be received well by the patients. How to document. We have eClinicalWorks, and we're fully integrated, so for us, that was a fairly simple thing. We just document it where medical documents it. And then the clinical flow for a positive screen, again, going back to that, when do we have time to do the dental piece? So our training, our licensed social worker and our patient navigator did the training. It was phenomenal. They did I can't let you borrow them, but they did a phenomenal job. And the dental staff had a better understanding of why we were doing this. And I think sometimes we forget, because we're so busy, that not every dental professional in our facilities have the same level of education, and maybe they don't have the background that some of the other staff has. So we just decided to assume that nobody knew anything about it, and I think that that was very helpful, especially for our front office staff. They had a better understanding about mental health conditions and oral health. What we really liked about the training is that we did the training in September. So we gave the pilot a couple months to work, and the staff who did the pilot were able to really share what they found worked and what they found didn't. I will tell you that they like to reverse the questions, and I believe it's in the last 2 weeks, have you felt down, depressed, or hopeless? Have you lost interest or pleasure in doing things, are the 2 questions, right? Yeah. So they wanted to switch it. It was suggested because of our pilot that they switch those 2 questions, and our social worker was fine with that. And then we now make that a part of our routine training for all onboarding, and also yearly training. So we bring our licensed social worker back, and we're working our way through different behavioral health conditions that affect us in dental, one of which being those patients that are just like, oh, you know, the ones where you go, oh, this is why we don't look ahead in the schedule. So see, everyone knows. But this training really was helpful for that, just for that. I found that we were so much more patient, and we were able to just look at our patients in a different way. They weren't just being a pain. There was a reason why they were behaving like they were. So here's our process that works into our flow. And your flows, if you decide to do this, may be completely different. So we do it as part of our medical history update, so it's at the beginning of our appointment time. We update the health history, and then we do the PHQ, it's called the PHQ-2 screening. If a patient scores 3 or higher, then we offer services from our patient navigator. Anyone that scores higher has, in our center, our processes, they have to be offered a time with our licensed social worker. And most of them choose not to do that, mostly because they're already receiving services outside, but many of them do. So if the patient accepts, then we use our EHR, and we send a telephone encounter, we call it eClinicalWorks, to our patient navigator, who then coordinates with our behavioral health person. It was very key for me to get it to where the dental staff was done with it as soon as we did the screening, and we could then do a warm handoff to our social services department, and they would take over from there. If the patient declines, we do document that, and we track that every month. That is part of our dental dashboard on our behavioral health integration and all the numbers. So this is what we found, and this was our licensed social worker. I stole this from her training, but we're able to go with what's wrong with you to what happened to you, and I think we'll be hearing about that a little bit later this afternoon as well. But that was a really key thing for us to share with our dental team, and it really has been helpful for all of us in the frustrating moments, which I'm seeing in our center is increasing lately. Is everyone noticing this? Are you having more behavioral health issues in the waiting room and checkout in the operatories? A couple of things that I found of interest in this program is that we've been able to identify depression. We start at 14 and over. I'm talking to our pediatrician when I return about going down to 12 because we're seeing a lot of depression in adolescents. I was at a nurse practitioner conference 2 weeks ago, and they did a course on depression and anxiety in children, and it was an eye-opener. We don't talk about that in our dental meetings, but it was amazing. Some of these children are receiving antidepressants and anti-anxiety medications, so you may see that in your patients. But what we found is that just as many patients, we were able to help with the social determinants of health. So many of them didn't want to see our social services department for behavioral health counseling, but they were interested in our other services. We've had a lot of food insecurities. We've been able to get a lot of our patients to our medical legal partnership for tenancy issues or that whole custody thing that we all go through. We have grandparents raising grandchildren kind of on the down low, so they don't have legal consent, and that becomes an issue when we're treating patients. And so we're able to get some of the grandparents over for that. So that program, this is what surprised me. The staff loved it. Nobody complained about it, not one time. The patients loved it. They were thankful. I actually got calls thanking us for doing that and doing this program. And we've been able to help a lot of people, dental patients, with services that they really need. And I'm going to put my operations hat on. From an operations standpoint, for me, I want to see, does this lower our no-show rate? It's kind of hard to determine that right now, even though it's been a year, because we've all been dealing with COVID and cancellations and last-minute cancels because people are sick or exposed or whatever it may be. So I haven't been able to get a really good idea of whether or not this program is actually decreasing our no-show rate, but it seems to me that it probably will. A lot of our patients don't show, not because they don't want to, but because they don't have transportation. They can't get through. I know we have call center issues and patients can't get through. Or they're just depressed and they just can't do it. So we were able to, Mackenzie, our patient navigator, does countdown calls to some of the patients that have issues with getting there on time just to make sure they don't need anything. So we've been able to incorporate that all because of the behavioral health component. So like I said, I don't have a slide with my email on it, but my email is in the book. So feel free to email me, anyone that would like the slide deck or just to talk more about it, and I'll be here all day today and tomorrow.